Right. So, hello everyone. My name is Tahir, and I'm a fourth-year medical student at Dow Medical College. Welcome to our series for the Neuromatch Road to Residency. Welcome to our fourth episode, which is called "The Life of a Resident in US." I'm joined by my co-host for today, Miss Aisha Duran.
Hello, everyone. I'm a fourth year medical student at DMC, and I'm a networking member at Sign DMC chapter. It's a pleasure to meet you guys today.
Thank you, Aisha. So, in today's episode, we are diving into experiences of a neurology resident. We have who have made a big leap moving from Pakistan to the US. We'll talk about everything from adjusting to life as a resident, managing work, managing life, dealing with burnouts, and what are the financial realities of a resident. I feel like these are a few things that are not openly discussed. We all, as a medical student, have a goal to get into these residencies. But what after that? What is the life after that? So I feel like it would be great if you guys share your experiences so that our viewers can benefit from it. So we have joined by two fantastic guests who have experienced all of this transition from a medical student to a resident. For starters, we have Dr. Shayan Garcia with a PGY2 at Cornell Health, Michigan State University. He's a graduate of Dow Medical College from 2020. Dr. Murcia has experienced public speaker. He was the ex-president of the debating circuit Karachi. He has worked with 30 research papers and is an enthusiastic neurologist. Next, we have Dr. Qasim Bhatti, who is a PGY3 at University of Mississippi Medical Center. He's currently serving as the resident chair of the Neurology Education and Recruitment Committee. It's a huge honor to have you both here, and honestly, I'm looking for the discussion today. So, without any delay, I'll start the discussion. I'll ask the best question first, and which is about the move from Pakistan to the US. Dr. Shayan, if you could just share some experience that how you transitioned from Pakistan to the US, how was the change for you? I'm pretty sure that it would have been a huge impact professionally and like personally. So if you could share your experiences, what were the challenges that you faced?
Yeah, thank you guys for inviting me over firstly, and I really feel that this is a great initiative. I think Tayyaba messaged me about this a few months ago, and I was pretty impressed by how you guys took up this forum and introduced something like Sign to DAO. It's important to understand as students how AAN works and how neurology works in the United States. So going on to your question, obviously the transition has been pretty taxing. Now it's in like my second year of residency, so I've kind of like gotten around what's going on. But the first few months, the first year was pretty, I would say, hard. Not just in the sense of, let's say, leaving family behind. Obviously, my entire family is in Pakistan. My parents, who are going, obviously, who are getting older, not younger. So that's also like something which I have to be cognizant of. Leaving family behind, leaving friends behind. I had a big social life back there. I had a big teaching career back there while I was studying for my boards and while I was a medical student. So leaving all of that behind, coming to the United States to pursue something that you have worked throughout for the past 10 years, whether you're passionate or not about it, it's definitely a different feeling. But us sabke alawa bhi, the culture is very different. The kind of and I'm a person who can come off as a cynic or a skeptic, but that's how I like to live life. So when I talk about culture shocks, I do talk about the fact that social media, movies, and shows that we watch, they create a very different persona of countries outside of Pakistan, and even I was kind of a victim of all of that. But when you come here, when you work with people from different backgrounds, from different cultures, and especially the locals, and if for some reason if you match into a place which is slightly more which is slightly less diverse, I would say, I would not use the word of discrimination or racism or anything else, but if you match into a place like I am in West Michigan, and I'm sure Kasim would also add on to this as well, places which are less diverse, which are not big metropolitan cities, the kind of culture that you have around is very different than what is perceived to be when you look at movies and social media posts of America. So navigating those kind of things, being cognizant of their slang, of how to fit in, um, that kind of takes a toll on you for the first few months at least. The one thing that helps us as Pakistani students is the fact that we speak fluent English language when we are back home. And I think उससे बहुत फर्क पड़ता है क्योंकि you would see here that people are coming here from who have different accents, who have different slangs, who don't understand a lot of lingo. But that's something that, so years of watching Friends or Grey's Anatomy or House at least taught me how to use particular statements and slangs, let's say while counseling a patient, right? Those kind of things are very important. So yeah, it's been hard, but this is what we strive for, and it's rewarding. It's absolutely rewarding, not just monetarily, but also in terms of your academia, in terms of your training. So yeah, I'm happy.
That's a great reality check, Dr. Shan. Honestly, when I talk to my batchmates and like people, they're like, we live that dream US life, but I'm pretty sure the reality is much different as you explained over here. I would also like if you could just shed some light on how the US healthcare system is different from Pakistan. I'm sure you had experiences of working in Pakistani hospitals and your house of care in Pakistan. If you could share some experience over that.
It's very different. It's very different, and I would say so. I just categorize this answer into three different categories. The first one is the difference of treating patients, right? So it's very different. I know in private hospitals in Pakistan, it's definitely better. But I worked in civil hospital, and as I said, I'm not gonna hide stuff. I'm not gonna brush stuff, right? Civil hospital में मरीज की कोई इज्जत नहीं है, मरीज की कोई वैल्यू नहीं है, जान की कोई वैल्यू नहीं है, which is the worst thing ever that I've seen in Pakistan. And that's consistent with how the country is functioning in other respects of life as well. So ऐसा नहीं है कि मतलब हम सिर्फ हेल्थ केयर में ये चीज देख रहे हैं पाकिस्तान में, हम ये चीज पॉलिटिक्स में भी देख रहे हैं, हम ये चीज एजुकेशन में भी देख रहे हैं, हम ये चीज कल्चर हेरिटेज सब में देख रहे हैं. सही है, वहां पर इंसान की कोई मतलब इंसान की इज्जत होना कम हो गई है. सही है. The mindset that doctors have in Pakistan is खुदाबंदी वाला mindset. And to an extent, that's a good thing as well as a bad thing. Doctors are put at such a huge pedestal back in Pakistan. They're literally secondary to God or something in Pakistan. And that's why they feel that they don't have, at least in government hospitals. And I've worked in civil for a year during the pandemic, which was like peak. I feel the pandemic showed so much about humanity more than any other war or any other calamity in the world had. And I have seen that firsthand. I've seen people not worrying about life, and that kind of like troubles me. So the first category is how you treat patients in general. That doesn't happen in America. America में patient की इज्जत है, patient की value है, the kind of counseling and the kind of time that the patient requires is given to the patient. But then if you talk about the second category, which is what kind of medicine are we practicing? So there are two kinds of medicine that I've experienced, and I know of from understanding healthcare philosophy. One of those is therapeutic medicine, and the other is diagnostic medicine. What we follow in Pakistan is therapeutic medicine or symptomatic relief, or things that should be worked upon at that particular time, and then we can forget about the 500 different things because lack of resources, lack of money, lack of availability of insurance, so on and so forth. तो वहां पर अगर एक मरीज आपके पास आएगा और उसके पास उसके उसके पेट में दर्द है और उसका अपेंडेक्टमी होना है, तो उसकी अपेंडेक्टमी आप कर दोगे. बट अगर चेस्ट एक्सरे पे या सीटी चेस्ट पे अगर अचानक से परमानेंट नोडुल मिल जाएगा, तो यू वुडंट केयर अबाउट दैट. यू लाइक, ओके, इट्स फाइन, इट्स नॉट अ कैंसर, गो ऑन. You will never care about that, right? And that's fine because the kind of patient that will come to you does not have enough money to get like yearly low dose CT scans, right? For screening purposes, for monitoring purposes. So I understand that. So therapeutic medicine Pakistan में बहुत अच्छी practice होती है. I feel Pakistan or especially government hospitals में the kind of doctors are produced are they're brilliant. They know their skill inside out. If talking from a neurologist perspective, Qasim and I both have experience with this last 2 years, I believe, is that neurology is an extremely examination friendly field. Like you need to do your neurological examination really well. Even if you're ordering like an MRI or a CT scan, you need to have your neurology exam well. Pakistan, mein, a neurologist will diagnose half of the diseases with just an exam. But the issue is that neurology as a specialty or any other specialty for that matter not all diseases can be diagnosed with just an exam. You need an MRI brain, you need an MRI spine, or else you can confirm your hypothesis. And that's the thing that America does really well, as it is following the core principles of diagnostic medicine. And these guys, they want to know what's actually going on before they can treat it, or even if they're treating it, they still want to know what's going on. So biopsy se pehle aap treatment start kar dete ho, but biopsy phir bhi karwate hain, because that's how you should live life. That's how you should practice as a doctor. So I'm a big fan of diagnostic medicine, and that is why I think I probably went into neurology, right? Because neurology is more of like a puzzle that you have to solve and whatnot. But I do have respect for people who work in low resource income countries, and like in Pakistan, and they follow therapeutic medicine. And then the third thing is culture between the doctors. The third category, the culture between colleagues and staff is very different as well. So you will see a proper hierarchy even here in the United States as well. ऐसा नहीं है कि यहाँ पर hierarchy नहीं है. You can see that there's going to be more passive aggression between different hierarchical points, but everyone will respect each other. So if you're a resident, if an attending is abusing you or pimping you or being mean to you, at a certain level, you can definitely call them out. If there's an APP or a nurse, you cannot treat them as inferior people. You have to consider them as your equals. And sometimes they're even better than you, man. Like the kind of work that the nurses do is just amazing. Like I just have so much respect for them. So you cannot treat them as someone who are inferior on the hierarchical table. Whereas in Pakistan, it's totally the opposite. Like if you're a doctor, you're the god of that area, and then everyone else is just your puppet and whatever you say. So if most of them, I'm not taking all of them, some of them are really good as well. I have had great attendings in Pakistan as well, and I still have contacts with them. But most of them, at least what I experience in civil, they think of them as something else. They think that they're above law. I mean, if I talk about myself, right, अगर मुझे रोड पे किसी ने कराची में रोक लिया सिग्नल तोड़ने के लिए, और मैंने अगर उस पुलिस वाले को ये कह दिया कि यार मैं डॉक्टर हूँ, तो मुझे जाने देगा. Why is that fine? Just because I'm a doctor, I cannot break rules and laws of being a civic citizen, right? So that's the kind of difference that you have in terms of culture when it comes to healthcare professionals. So these three categories.
Right, Dr. Shan, that is a very insightful answer. And honestly, these little things I feel like we as Pakistanis or an IMGs due to like a different culture, we like, sort of tend to ignore them. And like these, like the experiences you shared about empathy, about respect to seniors, I feel like that is something those who wish to pursue a residency or maybe career in US, they should be mindful of all of this and they should prepare regarding that accordingly. So thank you for that. And now I would like to move to the next segment, would be regarding the life as a resident. So Dr. Qasim, I would love to know your experiences as a resident so far, as you're in PGY3. I would love to know how your like experience has shifted from PGY1. What were your responsibilities in the year one, and then now currently as you're in PGY3?
Sure. So yeah, before like sort of I move on to this, I wanted to sort of echo Shayan's words. I have like a lot of experience in different healthcare systems, but like I'm close to the European healthcare system, the Canadian healthcare system, and I know briefly about the Pakistani healthcare system as well. And the one thing when you transition, wherever you're coming from, if you're coming from Pakistan, if you're coming from the Caribbean, Ireland, you the US prioritizes evidence-based medicine. That's what it is. That's simply what it is. It's evidence-based. All the recommendations are updated. You're following, like for example, for stroke, you're going to be following the AFAHA guidelines. You're going to ensure that everything is done according to a proper algorithm based off of your clinical job. And that is the big thing that you need to sort of prioritize whenever you're moving in. With regards to your question about the transition from first year to second to third, I for me, like I didn't do an internship or anything. I matched straight from med school. I was class of 2022. I applied in my final year. Well, it's a 5-year program, so fourth year you apply, and you get the match email during your last year. And my last year was basically me. I just had to just pass my exams, and if I did, I'll be fine. I'll be starting my residency. So it was super I was super happy that like everything worked out, to the fact that I was able to be on par with the American medical student, in the sense that I matched right in my final year of med school as a in class. So I'm class of 2022, going in from Bahrain um, to the US. I I had done my clinical electives already. You get that exposure briefly to the US healthcare system, but as an intern, it's very different. You're even as a neurology intern, you're going to be doing the first year is basically learning on the go. You're a medicine intern for most of the time. Like, my program is a category of a program. You do 8 months of internal medicine, 4 months of neurology in the first year. The big charm about our program is the fact that our first year also includes a continuity of care clinic every week, which is purely neurology. So that's a good charm, and that sort of gives you an additional exposure to neurology early in first year. The transition, you like going from med school to an intern. It's like, it's busy, it's hectic. Your rotations are hectic. I started off on hematology as my first rotation. And hemonc is basically like a step down unit on the floor. The patients are very sick. They're getting these complex chemotherapy, chemotherapeutics, like different regimens that they're on. Their white counts are super low. They're thrombocytopenic. You have to monitor them closely. The main thing you want to know that you want to do as an intern, see what your upper levels are doing, try to emulate what they're trying to guide you. You need to be efficient in doing orders, in doing admissions, in doing um, notes, and it's all about building that system as an intern. An intern is all about having that system in your head about how to efficiently care for the patient while balancing your clinical responsibilities. Um, Transitioning into second year, you typically do most neurology programs all over the US have a boot camp from first year to second year. That boot camp involves you're going to be doing intensive lecture series on like ENL, the emergent neurological system. This thing called ENLS, which is basically emergent neurological life. I can't remember the full abbreviation, but it's basically emergent neurological issues that somebody presenting with status, acute stroke, spinal cord injury, or a myasthenia crisis or something like that. So they're gonna go give you lectures, and then you're gonna be doing case simulations when you transition to PGY2. That's typically a month or two, and during this time you're also doing buddy call. Buddy call, you typically get paired with a senior, which is going to be a PGY3 or a PGY4, who's going to be in-house with you um, to guide you through your thought process. He or she will see all the emergent consults as well as all the non-urgent ones in the first month, and in the second month they sort of graduate you to a semi-independent resident. And if you're doing well, and they'll give you feedback. Um, and then after those first 2 months, you're fully independent typically. Second year, I know Shayan is going through PGY2, and I can understand why he's shaking his head like this, because PGY2 is the biggest and the most steepest learning curve in neurology. You're gonna get not like, in a way, like you're gonna get wrecked on call, but the point is that is where you learn. That's where you take most of your learning. You're supposed to do that. That is what PGY2 is. PGY2 is not easy. PGY2 is not going to be easy. But the biggest learning that you get, I don't know how your program does it, but typically night float is how you're gonna, some programs do night float, some people do 24-hour call, depending on the program and the size of the residency. But that is where you learn the most. And in second year, that is where you're going to be supposed to do, like you're going to be doing a lot of inpatient, a lot of inpatient. Typically, your stroke and general neurology services, you're going to be seeing consults. When you transition to third year, that's when you are taking that senior role. As a senior resident, your job is to sort of guide the juniors, supervise. It's the clinical work is still divided up 50-50. Typically, it's a half inpatient, half outpatient. And during this time, you're going to be, either if you're navigating fellowship applications, you're going to be working on that as well. And you're going to be learning how to sort of be that senior leading a team. And that's what I'm doing. And during this, and if you're passionate, which I am, I'm super passionate about medical education. I'm trying to sort of gear myself towards that clinician educator pathway. But that's what you do at your third year. And then fourth years is basically, either a chief year, either you do a chief year. Our program does like 2 chief residents, and either you're an academic or an administrative chief. Administrative chief is involved in building the entire schedule, figuring out what services need to be covered. Academics, they're in charge of the resident didactics, as well as trying to boost and sort of encourage research participation. That's how it typically works, and that's what the transition is throughout your years in residency.
Our program is very similar. I think I 100% agree with you on all respects, you said. And yeah, the second year of neurology is the hardest year. This is the hardest year I've ever had in my life. It's
what month is it right now? It's September.
Yeah, it's just the third month.
Yeah. So when are you gonna do the holiday schedule? Are you on for the holidays? Yeah,
I am on for the holidays. Yeah, that's where it gets like real serious.
Yeah.
Because as you said, like night floats, they don't start, at least in my program, until the 5th block. So they give us some neurohospitalist stroke, neurocrit experience until the 5th, 6th block, and then they put us on night float. So I agree with you. The kind of stuff that I've heard from my seniors, PGY3s from the last year about the holiday block and the night floats, oh my God, I'm so scared. So yeah, PGY2 guys, if you're interested in neurology, all the years of board prep, all your medical education, everything is on one side, and PGY2 of neurology is at one side in terms of difficulty.
वो कहते हैं ना वो सही रगड़ा लगता है लेकिन ये भी
सही लगता है लाइक एक्चुअल पता चलता है कि मतलब आप टू एन एक्सटेंट रिग्रेट करना शुरू हो जाते हो कि यार मैं मेडिसिन ही ले लेता, इतना आसान था मेडिसिन, तो आप उनको देख रहे होते हो चिंता रहते हैं PGY2 मेडिसिन से नोट्स भी नहीं लिखे,
रिग्रेट नहीं किया कभी, मैंने नहीं कभी रिग्रेट किया लेकिन
मुझसे नहीं होता but yeah, no, it's fun. Neurology is a lot of fun, man. Like, it's a lot of fun.
Yeah, I need to thank you guys. I
it's
mean,
a niche specialty.
Everything comes with an outside as well. So it's fine. It's fine. It's fine. I mean, at the end of the day, you were achieving that goal of being neurologist, a good neurologist. I feel like thank you so much, Dr. Qasim and Dr. Anusya, for your valuable insights. Now, I would request my co-host to take over and host the session.
All right. So, hello, guys. Thank you so much, Dr. Qasim and Dr. Shayan, for sharing your insights. It was really thought-provoking, and I would love to build on that point and explore the importance of work-life balance and burnouts in neurology. So my question to any of you who would like to take over is, burnout is something that we hear a lot about in these days, right? Especially in high-stress fields like medicine. So what are the personal strategies that you found helpful during your journey in preventing burnouts and maintaining balance in your life?
I think Qasim should take it because he must have faced it some point in time in PGY2. I just started with him.
Yeah, so I have a big opinion about burnout. And I've talked about it, and I'm a big proponent of wellness. But so everybody's approach towards this concept of burnout is very different. You are going to be busy. Residency is not that's what residency is. and that's how it's supposed to be. At the end of the day, you're taking care of patients, their lives on your hands. You have to make sure that you are competent. With that being said, burnout in itself, try to, there's going to be days where you're going to feel dejected. There's going to be days where you're like, oh my god, why am I doing this? This is so overwhelming. You There are going to be days where you won't be feeling up to speed, and that is normal. First of all, it's important to embrace that feeling. That is totally okay. um, Talking to your co-residents, talking to your friends, that's very important, sort of to share and sort of vent that whole uh, that ringer that you're going through. That is one. Second, that whole concept of work-life balance, that is, um, in terms of the time, more often than not, your time is going to be spent at work, and the remaining time that you have, which is going to be way less than the time that you spend at work, you just have to make sure that it's quality. It's not about necessarily, you can work like 12, 14-hour shifts, but then you come home. It's important to disconnect. It's important to disconnect. Everybody has their own thing. It's hard to manage a sleep, a decent sleep cycle in residency, but people can sort of either you try to incorporate like a decent workout routine, something that makes you happy. For me personally, I love coming to this coffee shop. I love coming. I love doing work here. On weekends, I make it a priority that I come, sit down, relax, do my work here. I have a 4.5-year-old daughter. Um, I had her when I was in M3, third year of my school. So I make it a point that I'm spending time with my family as much as I can when I'm outside of work. Um, the other thing is, you have this, the slowly it'll get better. Slowly you'll be able to manage time better. Second year is tough. It's going to be tough, but when you slowly move into PGY3, you'll see that, okay, you'll see the difference, that if you have time in your hands. It's not always going to be like this. Fourth year, you're going to have more time, and as an attending, you're going to be, or if you're going into fellowship, that is a different story. But my point is that after all of this is done, you're going to be able to build your own schedule the way you want it. If you want to stay in academics, you can build it in a way. You can be an academic neurohospitalist. You can be an academic stroke doc, where you can tailor your schedule to the way you want it to be. And if you want to do private practice, you can tailor your schedule to the way you want it to be. So those are my sort of 2 cents, but it's just important to um, be okay with the fact that there's going to be days where you're not going to be feeling up to speed, and that is okay. The important thing is to talk. The important thing is to make time for other activities when you're outside of work.
So I think I agree with Qasim. So guys, for burnout, I think everyone has a very different threshold. So some people can get burned out real early. Some people can get burned out real late, and then the magnitude and the intensity of the burnout can be different for different people as well. For me personally, I haven't faced burnout yet in the 1.5 years I've started residency, and most people tell me that you kind of face it towards the end of PGY2, because that's when you're really burned out. So I'm not looking forward to it. But I feel what is admissible here is for you all to understand, the audience to understand the science of ranting or the art of ranting. I'm a big proponent of ranting. And I believe that even though one must hear that, ranting or gossiping makes you a person who is evil and it's a sin and blah, blah. I feel as a resident, if you're not ranting enough, I think you're going to clog all of that in your heart and your mind. And then you're going to burst out on one day, which might come off as burnout, which might come off as an anger burst, which might come off as you crying for 2 hours, or you getting depressed, or you sleeping a lot more. So it's better to just rant. And as Qasim said, like, you need to have, so how you medical students, right? Like, you guys have groups, right? Clinical groups or friends, and you rant about, let's say, another friend or an attending or a resident, or your mother to them, and you feel like kind of like dil halka ho gaya, say, yeah, So I think that's something that is translatable into residency as well. I think you really need to have people who you can rant to. You really need to have safe spaces around you. And mostly those safe spaces become your co-residents because they're going through the same shit that you are. And I think that's how it's supposed to be. However, I do believe that ranting about medicine, patients, attendings, work should be at work only. So I have friends who would rant about all of this even when we're going on retreats or even when we're outside hanging out. I'm like, please don't do that. Please don't clog me with stuff that happens in the hospital outside the hospital. Outside the hospital,
Yeah.
talk to me about art, philosophy, politics, sports, blah, blah, but don't talk to me about medicine. So you need to have a good
No.
balance. I feel sports. So I'm not a big gym freak. I'm not a big workout freak. I should be. But sports is something that keeps me very close to not burning out. So I feel like I do cricket every week religiously. It's very hard to play cricket in America because you don't have enough people. But I've managed to find that group. So I play cricket almost every week or so. I make sure that I have a good group of friends, and we play board games. We talk about back home. I'm a big history geek, politics geek, so I make sure that I read enough things outside of medicine. So those kind of things like kind of keep you that one intricate characteristic or personality trait that you had when you were in Pakistan, don't lose that. I think that will prevent burnout in you.
Okay, thank you so much, Dr. Shayan, for sharing, and Dr. Qasim for sharing your experience. Dr. Qasim, I would like to ask you, how do you, as a PGY3, prioritize self-care amidst a busy schedule? Do you have any hobbies or activities outside of medicine that help you recharge?
Yeah, so I kind of like sort of briefly dived into it before. So I love sort of like going out in general. Whenever it's the weekend, we will. And the good thing about Mississippi is a lot of the state, like if you want to take a short trip, 3-4 hours away, you can go to New Orleans, or if you want to drive to Atlanta, you can. So what I do typically to recharge is whenever I have a weekend off, I will drive somewhere with my family. I'll go to Atlanta, or I'll go to Houston, or I'll go to um, New Orleans, for example, or Oxford, or whatever. I just like to explore new places. I like to learn their culture. I like to sort of see what restaurants are there to go to. Uh, love trying their coffee. Um, Going out to different parks. That's what I like to do. Um, the other thing that I like, to me, I think. And I wanted to sort of echo Shayan's point here. If you have sports is a big thing. When you have the time, try to incorporate some sort of physical activity, some sort of some sort of uh, thing that you can do. Like cricket. I used to play cricket whenever there's time. Like I'll go out, I'll play cricket, or I'll pickleball is a thing that I've gotten into now, which is very in the US it's taking over these days, which is basically tennis but for people that are slow that really can't run that much. But it's fun. Like pickleball is fun. Going out with your co-residents, things of that nature. That's what sort of keeps me recharged. And in PGY3, honestly, like you even if you're on a busy service, you are very efficient and you get the time. You and try to make like so this like for example this weekend after after reporting this podcast, me and my family are planning to go out for a lunch, and then I'm going to take my daughter to the park, things of that nature. So like that's what it is. Try to sort of set a boundary between your work and between your life outside of work. As much as you're passionate about medicine, I am super passionate about neurology. I love neurology. I can go on and on about all the like everything related to vascular or anything related to immune. But when I'm outside of work, I try not to. I try to refrain from it because that's gonna avoid you being um, being overburdened to the point of burnout.
Mhm. Okay, that's a great point to take home, Dr. Qasim. I'm sure many students will be able to benefit from learning about your experiences. To shift our focus to something that I believe most viewers would be very curious about, and it's the financial realities of residency. So resident salaries can be very tricky to navigate, especially with so much going on, right? So Dr. Shan, could you give us a sense of how much a neurology resident typically earns in the US and how much goes towards things like taxes and living expenses?
Yeah. Uh, if you guys don't mind, I would like to prolong this answer slightly and start from the beginning, because you guys are
Sure.
doing this like road to residency series, right? So it's also important to understand how much money goes into becoming a resident,
Mhm.
and then obviously the resident part as well. So I mean, by this time, whoever's taking steps, whoever's planning to sit for the match, they have understood it takes thousands of dollars, right? Like I'm not even kidding. Like at least $20,000 is the amount that I was able to, because I do this mentoring one to one so much these days, that I've figured out that there are some ways to evade some money being spent in places, right? So I think $20,000 is the amount that you need from step one to elective, step two, step three, ERAS application, and if you are traveling to the United States for second looks and hybrid interviews, like my program's doing hybrid interviews second cycle this year. So you need the money to come to the US if you want to match on my program. I feel they do like online as well. Anyway, so $20,000 is something that's seriously huge, given the inflation and the climate back in Pakistan, financial climate back in Pakistan. Visa dollar बहुत होते हैं यार. It's like close to what, 80 lakh rupees or something, on top of your own medical education. If you're in a government setup, even then you're spending money on, let's say, transportation, food, partying, which you need, right? And if you're in a private setup, then though basically you're doing your medicine for like maybe what, 1 crore rupees or something. So from early on, from your levels, from third year, second year level, I feel it's extremely imperative that you all start thinking like how an American or an international medical student, which is not from Pakistan, thinks like. So start thinking about earning money. Start thinking about avenues of bringing in money for your families. I know most of the people who pursue USMLE, even at this date, are people who are born with some sort of a silver spoon. And if you're coming from Pakistan, pursuing USMLE, pursuing the US residency match, your parents are at the back end financing your journey, which is a big, 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 big blessing. But I really think that that should not make you callous about it. That should still drive you to, let's say, bring in money for yourself, because you'll see when you're working in the United States, and obviously you're not going to be asking money from your parents, which you won't need because you earn enough here to support yourself and maybe another person as well, if it's a partner of yours. But you still need that grit, and you still need that stamina, and you still need that professionalism as traits when you work as a resident, which you can acquire from before. So I really think $20,000 hai. uh, get money from your parents for sure. Get matched the first time. Try to at least get matched for the first time, but make sure that you're also bringing in some money for yourself just to learn those professional trades, if not anything else. And then there are ways to apply for loans for people. I don't want to delve into this further. People who really want to discover those opportunities can talk to me privately. I'm always available. Um, so yeah, loans and whatnot. Going into the resident salary and going into navigating finances as a resident, it's pretty difficult. Last year, it was just me who was working. My wife was not a resident, but this year she matched as an internal medicine resident. So now we have a two physician salary, two resident salary, I would say. And that kind of like gives you a lot of leeway, right? So
Mhm.
neurology residency pay, and most residencies, they pay you anywhere from between $57,000 to $65,000, depending on state, depending on where you live, so on and so forth. So in New York, you'll probably be earning $65,000, $66,000 as a neurology resident. My program pays, I think PGY one is $62,000, and then it goes 2 or 3,000 as you get promoted. And then if you go to different parts of the country where cost of living is cheaper, you can have salaries ranging from 55 to $60,000 as well. So I have the entire hisab in my phone because this was a question I was expecting. So let me just like go through that thing which the
Mhm.
hisab that you need as a resident, right? So if I'm earning $62,000
Mhm.
as, let's say if I'm earning $67,000 right now as a PGY2, that's without taxes. So once the taxes are cut, मेरे पास इतने नहीं आते, मेरे पास $4,000 आते हैं. So yeah, so per month I'm supposed to earn at least more than $5,000, but I'm earning just $4,000 because tax cut hota hai. So if I'm getting $4,000 per month as a PGY2 right now, I have to manage rent, I have to manage my car, financing a lease, whatever. I have to manage my utilities. I have to manage my So I came here after loans. I took a lot of loans from a company and did a lot of stuff to get here. So I have to pay back those loans, right? And then there's your credit card payments. There is your grocery. Pakistan पैसे वापस भेजने होते हैं बाप आपको वो भी है. And then there's some saving, and then there's some खर्चा for your travel and your tourist hut, right? So out of those $4,000, एक रुपया भी नहीं बचता towards the end. Like saving होती नहीं है. If you're the sole earner, बहुत मुश्किल से saving होती है. And if you have a kid, if you have a family, it's even worse. Sometimes you even go down under, right? So if I'm talking about, let's say, an average place where the cost of living is not that high, so if you divide $4,000, you'll be at least paying. Right now, America is going through like the highest inflation rate in history, right? So you will be paying for rent, let's say, anywhere from between 1,500 to $1,700 if you were living in a one-bedroom apartment. If you have a family, right? 1,500 is like a good bedroom, one-bedroom apartment, very near to your hospital. You don't have to pay much. But if you go further away from your hospital to the suburbs, you can even get apartments for like 12 or $1,300 in areas which are like averagely population dense, not like Chicago or New York, right? And then in America, most of the places, like Qasim and I are in places where we need a car. We cannot function without a car. Impossible. Hai. Transport system बेकार है America का, ठीक है? So if you need a car, then you need to know whether it's financing a car or leasing a car. Financing a car is definitely slightly more expensive. Leasing a car is cheaper, but then financing a car means that you own the car by the end, and leasing a car means that it's probably renting a car. So you need to factor in those kind of things. So $500 कम से कम गाड़ी में जाते हैं, ठीक है? अब आपको ये भी देखने का गाड़ी कौन सी लेनी है. If the place that I am in, it snows heavily in the winter, so I need an SUV with snow tires. Whereas Qasim probably does not need that because Mrs. B में snow नहीं होती है. तो ये सारी चीजें बहुत cognizant होना होता है इस चीज के लिए. And then उसके बाद you need to pay for your phone bills, you need to pay for your electricity. Groceries not cheap these days. America is getting shit expensive. And then so on and so forth. So $4,000 कुछ भी नहीं है, बचते ही नहीं है. You $4,000 is nothing. You need to have alternative sources of income, or you need to have a partner who is earning almost the same amount of money, because you have responsibility back home. Most of us would want to send money back to our mothers, our parents. So it's hard, but हो जाता है. And Hamisha, like the people who ask me, Dr. Shayan, how is it possible that we manage everything and then we also manage our homes back home? I just tell them this. मुझे एक बात बताओ, तुम सिविल में काम करके ज्यादा कमा रहे थे या तुम यहाँ काम करके ज्यादा कमा रहे हो? बस सिर्फ ये याद रखो. I know conversion and cost of living वगैरह यहाँ बहुत ज्यादा है, but just remember this, that Pakistan में the highest residency salary probably AKU की होगी, and that would be around 1 lakh or something. So if you convert that into earning as a resident here, you're at least earning 12 to 14 lakhs rupees. I know उसमें सब खर्च है, कुछ नहीं बचता, but you're still earning more. And as physicians, the exponential growth that you can expect is huge. So an average neurologist, I'm talking about a neurologist who is not specializing in any of the other specialties, like super specialties. I'm talking about a general neurologist, outpatient doctor. They earn at least 210 to $250,000 anywhere in America. And if you go like super specialized, if you are a neurocrit doctor or a stroke doctor or a neuroimmunologist, those kind of things, epileptologist, you are earning anywhere from 280 to $320,000 after tax cutting. And then you can always earn more if, let's say, you're managing your ICU, if you do more calls, if you're let's say, if you're in South Dakota or something, so you're earning even more. So eventually, all of this culminates into something great for you, monetarily speaking, and even academically speaking, it's worth it. तो शुरू के कुछ साल मुश्किल होते हैं. You need to find footing. You need to have people around you who are doing the same thing, who have done the same thing, your seniors around in that area, and they can perhaps be of great help when it comes to financial planning. हो जाता है यार, घूमते फिरते भी हैं, ट्रैवल भी करते हैं, सब करते हैं, वेकेशन भी लेते हैं, पाकिस्तान भी जा रहे होते हैं, तो हो जाता है, सब हो जाता है.
Okay, Dr. Shan, building on to your point, what are some alternate sources of income that you talked about? And do you guys get time for it after a hectic residency time?
Time is kind of like the biggest issue, because I am a person who comes from like a staunch business family, and I have this like business mind as well, where I want to build on more money from money. But again, the best alternative source of income that I have found is teaching. So teaching online is like the biggest source of income that I've had alternative, which obviously has died down in the past 6 to 8 months for me, because as PGY2, you don't get time at all. So I've just accepted that reality, and I'm not even pushing myself anymore. But teaching is great for people who have great experience with research. They can definitely delve into copywriting. That's a very good way of alternative income. And then other things, some people like to invest in stocks. They want to indulge in finances, so on and so forth. So that the third option is something that I am looking into now because that requires the least amount of time, but it also requires the most amount of skill as well. So there are a lot of alternate sources of income. I don't think as early residents you can manage anything else except residency because there's so much to study. There's आपके खुद के research projects होते हैं, आपकी खुद की life होती है. It's almost impossible to even try to find an alternative source of income. For those who are
Yeah.
H-1B visa holders and green card holders or blue passport holders, they can moonlight once they're in PGY3 or like late PGY2 or something. So moonlighting is a really good alternative source of income as well. But yeah.
Yeah, that's what I was going to mention. I think Shayan has covered everything, but as a third year, typically most programs have this policy that you can't moonlight until your third year because of the fact that PGY2 is going to be super hectic. And then if you do that, you're going to encounter work hour violations for these things. But moonlighting is an option if you're not on a J1. So J1 unfortunately does not allow moonlighting. But that you can do like disability physicals, you can do like in moonlighting, you can like take extra locums, extra call shifts at an ED, something like that. You can do a neurocritical like a shift in the unit that could pay up to like $1,000 in a day. So that is a good option for folks that are not on a J1.
Some academic programs also have like other possibilities. So at least with MSU, what they do is that they
Yeah,
offer mentorship to their MSU students by residents and by
yeah,
attendings. So I have like two students that I mentor, and for one
yeah,
student, like I mentor them with research, right? So I'm teaching them how to do research. So they pay me like $500 for one person.
yeah.
So that's another thing that you can do. Yeah,
That's a good
but yeah,
option to
there's
do.
not much. Yeah, there's not much. Like there's not
Yeah.
much. You have to study. You have to focus on your residence.
Okay. Thank you so much, Dr. Shan, for sharing your insights. It's really valuable to hear about your perspective. My next question to Dr. Qasim is, looking beyond residency, what's next for you? What are career paths after finishing neurology residency? And what advice would you give to others who are just starting out?
Okay, so I have a pretty long answer for this, but I'll try to keep it succinct and as concise as possible. First of all, like as a neurology resident, that is my sort of go-to. Like neurologists are always in demand. You're Everybody's looking for neurologists, so you're never going to be without a job. And he'll like Shayan, in PGIT, you'll probably see this, when you get a consult, and like that's why they need us, because they really are scared of the brain. Neurophobia is real. A lot of people are scared about with anything related to the brain, and they don't understand it. And it's a very niche specialty that I don't think will ever go out of demand. Um, with regards to pathways beyond residency, one thing is you want to first and this is something that I think uh, as a PGYQ, it's you have to make a decision, because if you want to pursue fellowship, you typically make that decision late PGY2 or early PGY3. So one is, do you want to do a fellowship or not? Now, most most programs are very inpatient heavy, so you get exposed to mainly stroke and general and all the acute settings, from managing status, managing myasthenia, managing AIDP, like AIDP mainly, all of that stuff, and then acute stroke and MS flares and all of that stuff. But in the acute setting, so you get exposed to a lot of inpatient initially, and then slowly you go to like a transition into an outpatient thing. So that decision is pretty early. So I would highly suggest that make use of your electives in second year. Try to take different electives. Try to get exposed to EEG. Try to get exposed to subspecialty clinics to see how those work, because you get that perspective of how outpatient neurology works. And a lot of neurology is outpatient. With regards to like options in subspecialty training, there's so many. There's so many in neurology.
I think
I mean,
22 specialties,
yeah,
22
there's so
fellowship
many.
opportunities. Yeah.
Yeah, and that is what like if you want to do a pure inpatient thing or something like inpatient outpatient, you like, so vascular is a big one. Vascular, neurocritical care, you can go into neuroimmunology, MS. Some programs are purely MS related. Epilepsy, you can do intraoperative monitoring, you can do remote monitoring. That is a very great and very lucrative, in my opinion, a very lucrative option to do when you do epilepsy. Clinical neurophys, neuromuscular, you can do sports neurology, you can do sleep, you can do, there are a lot of options. It's just about how to figure out what your interests are. Now, that is if you want to, and then if you want to stay in academics versus if you want to stay in um, private practice, that's another thing that you need to figure out. Um, I am a I'm really interested in academics, and I want to build my pathway as a clinician educator. So for me personally, I would like to stay in an academic setting. Um, and that is the question you want to ask. In academics, you sometimes what Shayan is mentioning, the salaries are sort of not as high as, let's say, somebody that's going into private practice, but still it's decent. In academics, you will have the option of your junior residents that you're going to be teaching. You're going to be involved in teaching residents, med students. You might even be involved in hospital administration if you want to pursue that whole program director to a fellowship director route. You can do that. With regards to private practice, general neurology, subspecialty, you can it can be busy. It can get pretty depending on where you want to go, but you can pursue that, and certainly there is more. It's financially more lucrative if you do that route. Um, if you want to stay in a go to these big conferences, ANA, you can do that even as a private neurologist, but you just have to make sure that you are also involved academically a little bit. um, so there is a lot of options. For me personally, I'll be doing vascular, and the application is literally in December, well, mid-November, so I have to make sure everything is done, everything is uploaded, um, and hopefully like that works out. Um, so that's sort of like, so you have many options. It's all about how to figure out what and unfortunately, you don't really have that much time, but that's why I'm saying make use of your elective time to figure out your that process. Um, yeah, so that's sort of like my concise version of a very long answer. And you guys can all email me if there's students that are interested, if they're residents, like that are interested in sort of good or like thinking about fellowship and stuff like that, just how to sort of navigate everything. Email me. Um, I'm happy to help.
I feel a lot of it is personality based as well, right? Like Kasim, like there are some people who would like inpatient more, outpatient more.
हाँ हाँ
Or the
मुझे तो
sometimes,
खुद पता, मुझे तो शुरू से पता था क्या मुझसे मतलब लाइक जिसको थोड़ा सा आउट पेशेंट का मतलब वो होता है ना कि यार ये मतलब स्लो है, आपको हाई एक्यूटी चीजें
हाँ,
पसंद है, आपको मतलब लाइक जल्दी काम करना पसंद है, तो आपके
मेरा
लिए
भी
फिर न्यूरोक्रेट या फिर वैस्कुलर वो में
exactly.
ज्यादा मजा
Yeah.
आएगा. अगर आपको
Yep.
अगर आपको मतलब आउट पेशेंट वाला इंसान हो और आपको वो चीज करनी है कि आपको दैट होल solving that quote unquote puzzle,
Hmm.
figuring out exactly those rare autoimmune encephalitis type picture, LGI1
Those kind of
इतने
things, yeah,
ज्यादा
all
molecules,
those kind
तो
of
फिर
things.
वो आउट
इसीलिए आई
तो
थिंक व्हेन अ लॉट ऑफ मेडिकल स्टूडेंट्स आस्क मी कि शायद भाई हमें क्लिनिक न्यूरोलॉजी क्लिनिक में इलेक्टिव या ऑब्जर्वेशन मिल रही है, शुड वी डू देम? I tell them that, dude, you don't understand that 70% of neurology that happens
is
outpatient.
outpatient.
It doesn't
Yeah.
happen in the hospital. So if you're
Mm.
getting an observership or an elective opportunity in a neurology clinic, don't think of it as a low acuity LOR. Please don't do that, because most of the examination skills, most of the diagnostic neurology happens in the clinic. हम अस्पताल में तो पेशेंट को स्टेबलाइज करते हैं, एक प्रिलिमिनरी डायग्नोसिस बनाते हैं, फिर उसको बाहर भेज देते हैं, एंड देन फिर आवर आउटपेशेंट कॉलीग्स दे डू दैट. सो yeah, just take that opportunity and do those electives in the clinic, because trust me, that will help you if you have a good LOR.
Yeah.
Yeah, that's something that I wanted to add.
Okay, thank you so much, Dr. Qasim and Dr. Shayan. Dr. Qasim, you talked about vascular as your subspecialty that you're thinking about, right? So what factors influence your decision to choose it?
Well, yeah, sort of just going
एल्गोरिथम
on.
फॉलो करने का शौक है.
नहीं यार, algorithm मेरी मजा आता है वो जो that so to me at least. Yeah, it is algorithmic. I agree with that fact, but my point is, so to me, there is no other feeling that I can get. Like when there is a very smoothly run stroke code, it makes me feel so good. Matlab, like a person coming in, a person coming in with like sudden onset of aphasia, full left MCA syndrome, and then they come in, they're within the window for thrombolytic. They also have a left M1, and they have no contraindications, and you literally give them TNK. You give them TNK, you call the neurosurgeon. That's one thing that we do. We call the endovascular like neurosurgeon on call. We call them, which is an intimidating fact, but that is something that we go through. You call them and you're like, hey, I have a left arm one, this is what the penumbra is, this is what the core import is. I think they're a good candidate, and just give them the MRS and everything, and they take it, and then literally the next day the patient is talking and moving everything. Oh my God. That feeling is by far, and that is not something that you see like in other some other sort of specialties. That feeling you can I think just in that more acute vascular setting, and then it also gives you that adrenaline rush. So to me, I think that's why I was so attracted towards vascular. The other thing is just to echo Shayan's words, personality is a big thing. If you're really into high acuity and sort of if you like that whole high acuity aspect of things, vascular is a big thing in neurology. If you like procedures, neurocritical care is something that you can think about. And then you get these niche things in vascular, those rare sort of vascularities that you can dive into, carousel. That's something that I don't expect you guys to know now. Shayan would know probably, but those sort of little rare things are those rare things are also pretty cool to manage, and that's something that you do in the clinic setting. And the call schedule, honestly, for vascular, you can sort of create it in your own way. If you want to do the whole stroke neurohospitalist route, in an academic setting, it's typically 7 on, 7 off. I'm a big fan of it. I'm fine with it. And then, if you're in a big academic program, you have residents working under you. Typically, it's the two or the three that's running everything, and they call you and you sort of staff that code way. Like my attending is literally he's remote, and I call him. I come and it's the resident that does all the work in the sense of managing and acutely sort of doing everything after discussing with your attending. That in itself is a very big responsibility, but being on the other side, teaching that resident and going through their thought process and sort of acutely managing everything, that's something that I really found attractive. So, I mean, for me, I think master makes sense.
I think a lot of room for research as well, because I'm looking into vascular neurology versus neurocrit as well myself. Like maybe stroke versus ICU.
Yeah.
So I think there is so much potential for research. Like I love research, right? So if you're a vascular neurologist, you get so much leeway into research. Like most of the bigger clinical trials in neurology, they happen in stroke, right? So that's also a big factor. Stroke is literally the second most leading cause of death in the United States after heart disease. So it's like either you're a cardiologist when you're always going to
research का तो बहुत इसमें है, तो आपकी जो सारी बड़ी trials थी वो मतलब I think that all revolutionized stroke care, और अब नई trials आ रही हैं for anticoagulation, for changing stenting and all of that. There's so many trials that are going on. Endovascular is an option अगर आपने उसे endovascular का lifestyle थोड़ा सा hectic होता है, काफी hectic होता है, honestly, depending on where you're going. That's something that I have thought about, but it's something that that's another reason why later I can think about endovascular. It's a good option to have. और एंडोवास्कुलर की और लंबी होती है, उसमें there's 2 years after vascular. Um, but they're not a lot. There are programs at the job, but like you kind of it's something that if you want to do intervention, then there's two routes to into it through neurology, either vascular or neurocritical
Mhm.
care. Um,
Yep.
so keep that in mind if you're thinking about that.
I'll also give you guys, like the audience who are preparing for this cycle or perhaps the next cycle for interviews, a pro tip, something that I did not understand when I was giving my interviews. So when you guys talk about why neurology in interviews, and when you say that, oh, I love to solve puzzles and localization and blah blah, and then if they ask you, okay, where do you see yourself in 10 years, you're like, oh, stroke doctor. Don't do that, because most of the localization and most of the puzzle solving happens with things like neuromuscular or neuroimmunology or general
Yeah.
neurology. That's not stroke and neurocritical care. So just be
Yeah.
cognizant of that. क्योंकि कोई कुछ कहता नहीं है, but people are laughing in their heart like, what are they saying?
वैसे अब मेरी तरफ से ये प्रो टिप है, ये जो है ना सॉल्विंग पजल वाली बात, ये बहुत क्लीशेड
Totally.
आंसर है.
Yep.
ये
Yep.
बहुत ये मतलब बोलने की जरूरत नहीं है, ठीक है ना. जस्ट इट्स इम्पोर्टेंट टू मेंशन a patient care experience या आपका पर्सनल एक्सपीरियंस क्या रहा है, rather than you saying कि हाँ भाई मैं तो डिटेक्टिव हूँ, मैं शर्लॉक होम्स बनना चाहता हूँ, मैं ये करना
We don't
चाहता
do
हूँ.
that.
ऐसे
Nobody does that.
ऐसे नहीं करते हम लोग. ऐसे नहीं
Localization is
करते
pretty standard. Like it's very standard now. Like you start from the brain and you go to the peripheral nerves and muscles. It's very standard. There is no
एग्जैक्टली. काफी
detectiveness there.
ऐसा नहीं होता. हमारा
Yeah.
एग्जाम बस बहुत बताता है, आप ये कर सकते हो कि
Yeah.
यार you're a big fan of the neurological exam, because honestly
Yeah.
this is one of the only specialties that
There's an
where the
exam.
exam matters so much.
Yeah.
Okay, thank you again, Dr. Qasim and Dr. Shayan, for all the incredible insights. It's been such a pleasure having you and hearing your journey advice. Before we wrap things up, I'd love to hear what's one piece of advice that you'd like the residents who are just starting their journey out or those who are about to match into neurology. What's one thing you think is most important to keep in mind?
So quit medicine if you can. I'm just kidding. Don't. If you are really pursuing neurology as a specialty, please do not. Please, for the love of God, do not pursue it as a backup to medicine because you don't think you will match into medicine. That's like the biggest issue with Pakistani applicants these days, is that if they have slightly lesser step two scores, they think that they can match into neurology and they think they will do a fabulous job as a neurologist. That's the biggest bogus statement that I've ever heard in my life. Because yes, that's true that most neurology programs do not care a lot about your high scores. They don't want you to have 270s and 280s, but that's not because of the virtue of the difficulty level of the specialty, because the difficulty level of the specialty is definitely higher than a medicine specialty, that than internal medicine, not a medicine specialty, internal medicine. But the reason why they don't care about scores is because there's not enough competition between IMGs. If you look at medicine programs, competition between IMGs is so damn so damn common that people who have 270 and 260s will definitely be come out as better on paper applicants than other ones. अगर आपको लगता है कि you like neurology, only then pursue it, because trust me. Okay, just understand this, right? So people undergo 3 years of training, let's say as a pediatrician or as an internal medicine doctor or as a family medicine doctor, right? And then they pursue a subspecialty, let's say cardio, hemonc, pulm, sports medicine, so on and so forth, right? Imagine this. We as neurology residents, we start with a specialty directly from the get-go. Like we have some like 7 8 months of medicine training, but that's just to understand the American healthcare system. That's not for medicine. And then we deep dive directly into a super specialty which is going to train you as a specialist at the end. So agar aapka ye guman hai na कि it's an easy route to be in America and to becoming a doctor in America, you are mistaken. You will hate yourself if you choose neurology just because you could not get into medicine according to yourself. You'll have to be really good at MRIs, CT scans. You'll have to be really good at localization. You'll have to be really good at examination. You'll have to be really good at solving mysteries that other teams cannot. Most of the consults that we get are encephalopathy, and most of those encephalopathy are not neurological. So we are doing a lot of job of a hospitalist as well. So you need to understand that. So please do not take neurology as a backup. I really, really, really would stress on that. That's like my only piece of advice. Baki chill karo, party karo before you come to the US. Anyone who's applying, Don't take stress on yourself. Don't start reading FA or Snells or anything before you match. Like just relax. These last few 8 months of your time in Pakistan are the best months that you will ever have. So
Dr. Qasim, do you have
Yeah,
anything to add?
yeah, for sure. So yeah, like it's kind of unfortunate to actually hear the fact that I think वो जो लोग सोचते कि it's a backup to medicine, and मुझे ये थोड़ा सुना था मैंने, but I didn't know that it was actually a very prevalent opinion in Pakistan. But like I like when I was applying to like मतलब आरसी से करा था in Canada or US में, people that are applying into neurology are genuinely interested in neurology. They know the entire application. When you're applying into neurology, like it should never be a backup, and it's very easy to tell. PDs can easily tell that this is not something that this person is applying into just based off of a genuine interest. Um, and that's not just my advice for any, like, whatever specialty you're applying to, like that's how it is. Your हाँ ठीक है scores, but if you go into the charting outcomes, honestly, this charting outcomes, medicine and neurology, they have very similar charting outcomes in terms of the scores that are required to match into that subspecialty. The like if you go by the applicant number and how many match, but when you're applying into neurology, you need to make sure, like having a genuine interest, having neurology specific MORs is very important. For any specialty that you're applying, people get fixated on scores. People get fixated कि यार मुझे step 1 में 240 250 मारना था, अब तो pass fail हो गया, step 2 में 250 260 मारना. ऐसे नहीं होता. I think a good letter, a very strong letter from a very strong letter can take you to places more than a good step 4. So steps को नहीं matter करते, letters matter करते. Letters किसी बड़े इंसान से, अगर आपने किसी बड़ी जगह से research किया है, आपने किसी बहुत अच्छी जगह से elective किया, and you worked with a big neurologist or somebody that is really well connected, that can take you places more than a score. Score जो है वो एक सिर्फ filter को overcome करने के लिए होता है, and honestly जितना हम लोग फिक्सेट करते हैं, पर्टिकुलरली ये मैंने पाकिस्तानी मेडिकल स्टूडेंट्स बहुत देखा है कि वो कहते हैं कि मुझे इतना आना है, वो बोलते भी बहुत फ्रीली कि मेरा इतना है, इससे कुछ होता नहीं है. ठीक है कि मतलब लाइक क्योंकि at the end of the day when you come into residency, like okay, you're a good student, that's not what that's not what they want you to be teachable. It's important to be teachable as a resident. It's important to take feedback as a resident. It's important to take feedback constructively as a resident. That's what you need to be. That's the mindset you need to have when you come into residency. So that is my first thing. The second thing would be agar jab aap, when you've mashed into into residency training, don't worry about you'll learn on the go. You need to relax. You need to keep yourself engaged in training. You don't have to worry about the fact that you learn. This is how you're gonna learn on the job, and then do some reading while you're there. Whenever you're calling to staff something, make sure that you have a plan in your head. Look up something. Okay, let's say, so this is something for like early year residents or second year residents. When you're calling, you're attending. My main thing is you should have a plan, or at least something like a basic thing. It's somebody that's most common consult that you get is encephalopathy. Now you don't know what alternate mental status consult are. You need to have a picture. You've done an exam. You say this is what I think it is. This is metabolic. The kidney numbers are deranged. You're on cefepime, whatever. ये एक idea आपके पास already एक plan होना चाहिए, and then that's what you should mention. So come up with your own plan. Don't try to rely on your senior, or don't try to rely on your attending to give you the plan, sort of spoon feed it to you. So that's the mindset that you need to go into when you're early year resident and as a med student. When you've applied, तब relax करो और letters पे ज़्यादा focus करें. Electives पे जो है आपको बहुत active होना ज़रूरी है. You need to, इनके med students जो आप लोग इधर देखोगे ना, M3 M4 ये they're very engaged. They have a system that they take on patients, they take on multiple patients. अगर आप एक inpatient elective कर रहे हो, ठीक है, अगर आप एक inpatient elective कर रहे हो, तो try to help out the resident. You know, med rec कर दी आपने patient के लिए, आपने records वगैरह मंगा दिए किसी outside hospital से, इस तरह की चीजें करके that's how you should do be on elective. And take more patients, try to help out with their notes. इस तरह की चीजें करो तो that's gonna go a long way more than the fact कि यार भी मैंने 270 मार दी इस टाइम पर, बहुत लोगों की आदत है ऐसा।
Okay, a big thank you to both of our guests for sharing the experiences with us today. Residency can be tough, but also incredibly rewarding. And we hope this conversation gave you guys a real glimpse into what life as a neurology resident is all about. So guys, if you enjoyed this episode, please don't forget to like, share, and subscribe us for more great discussions. See you again next time. Until then, take care. Thank you.
Thank you.
Thanks so much,
Thank you,
Dr.
Ram.
Qasim.
Thank you, Dr. Shayan, Dr. Qasim. It was wonderful having you guys. Take